friends, this is Jason Williams, DO. This is the Williams Family Medicine channel. This channel is intended to help you live your best life. And today I am filming from Colorado. Today I'm going to talk about cannabis and cannabinoid receptors, fitting for Colorado since it's legal in Colorado. Cannabis and THC have been around since thousands of years ago. Cannabis is a polarizing subject and is legal in some states, but not others. You can debate all day long about the safety and abuse potential of cannabis. This video is not about that. This video is about how to leverage your health with regards to the endocannabinoid system. This system was discovered in the 1980s. It was discovered that we have CB1 and CB2 receptors in our body, which are cannabis receptors. And then it was also discovered that we have a couple of major cannabinoids. I'm going to just shorten their names and abbreviate. One is anandamide, or it goes by AEA, and the other is 2-AG. There's also cannabidiol, which has been found to decrease seizures in some patients and is FDA approved for seizures in a few different clinical conditions. The endocannabinoid system is very fascinating. Endocannabinoids are synthesized very quickly in the nervous system. They actually regulate themselves and they regulate other neurotransmitters at the synapse level. Other neurotransmitters are produced and packaged in vesicles for release at the end of neurons at the time of need, a slower process. Endocannabinoids interact with dopamine and the other neurotransmitters. Besides that, they've been shown to have effects on apoptosis, which is programmed cell death, and mitochondrial function. They also affect certain ion-gated channels. All this is very sciencey. Just means they have a lot of different effects in the body. These cannabinoids are synthesized from omega-3 and omega-6 fatty acids. So we'll talk about that a little bit later and the importance of that. As I said earlier, there are CB1 and CB2 receptors. The CB1 receptors are mostly found in the brain and central nervous system, and the CB2 receptors are found in the peripheral nervous system. It appears that the main functions of the CB1 receptors are to affect temperature, hunger, mood, stress response. The CB2 receptors seem to be more important with immune function and toning down inflammation. When we discuss the calming effect of cannabinoids, it looks like they modify the GABA nerve transmission. In prior videos, I've talked about the GABA, which is the calming neurotransmitter, versus the glutamate, which is the excitatory transmitter. The endocannabinoid system seems to improve the GABA tone or improve the calming effect. Endocannabinoids can cross the blood-brain barrier, which may have something to do with their psychoactive effect. When this system is out of balance, unfortunately, patients might experience schizophrenia or psychosis. This is important when I discuss THC here in a little bit. The prevailing theory about runner's high is endorphin release causes a calming effect and almost a disassociation and a lack of pain. But it's found that the endocannabinoid system seems to act faster and has receptors in the skin that might be triggered by the act of running. Even though some long-distance, high-intensity swimmers are very active, I have not heard of reports of swimmer's high. And this may be partly due to this activation of these skin receptors. It's unknown. So why do we care about the endocannabinoid system? Well, first, let's talk more about THC. Once again, this video is not a debate about THC. My experience in the emergency department has led me to believe that the risk of using THC is fairly great, although my population subset is skewed. Many times during a shift, I would see a patient with severe abdominal pain and vomiting secondary to cannabis, a condition called cannabis hyperemesis. Some of the emergency department providers that worked in my group in Kansas also worked in Colorado, and they experienced cannabis hyperemesis at a much higher frequency than we did in Kansas due to the legalization in Colorado. I also had occasion to see patients with severe psychotic episodes after marijuana use. So once again, a skewed population. There's a great interest in psychedelics in treatment for many kind of stressful conditions such as post-traumatic stress disorder, severe anxiety, severe depression. And these include ketamine, THC, etc. I'm not trained in this area, and I cannot speak to the efficacy of this treatment. I know there have been some anecdotal reports of success. I also wonder about the potential harms from such treatment and the risk of bad trip or psychotic episode. I'm more interested in leveraging the endocannabinoid system for your health in a way that does not seem to put you in danger. There are certain foods that seem to stimulate the endocannabinoid system, and I'm going to read a list of some of those. They include truffles, dark chocolate, coffee, oregano, curcumin, cinnamon, chia seeds, hemp, walnuts, sardines, anchovies, and eggs. A lot of these foods are omega-3 containing type foods. Earlier I said that fatty acids were precursor requirements for production of the cannabinoids. It has been shown that medium and high intensity exercise also stimulates the endocannabinoid system. Researchers have documented increased levels of anandamide, AEA, after moderate or high intensity exercise. Stress reduction and meditation activity also seems to improve your endocannabinoid system function. I read of a 4-day study of a yoga meditation retreat where participants in the study had blood levels drawn before, at the completion of the 4-day convention, and then 1 month later. Even 1 month later, the participants were found to have elevated levels of endocannabinoids and an increased sense of well-being. CBD oil is out there. It is FDA approved for use for seizures, but the FDA has also offered a strong caution about CBD oil and indicates that it may cause risk for gastrointestinal distress and even liver failure in some people. In the United Kingdom, according to a survey, up to 10% of residents have tried CBD oil at one point. And of those that responded, 90% reported some improvement in stress, sense of well-being. Stress is a very important factor for your overall health. The Williams Family Medicine channel desires to bring to you tricks and techniques to help improve your health, improve quality of life. I'm going to read off a list of some chronic health conditions that have been directly linked to stress that you don't want. They include asthma, eczema, urticaria, rheumatoid arthritis, ulcerative colitis, chronic pain, pelvic pain, back pain, diarrhea, constipation, peptic ulcer disease, anxiety, depression, psychosis, insomnia, diabetes, hyperlipidemia, obesity, neurodegenerative diseases, and even osteoporosis. Decreasing stress is very important. In medicine, I'm interested in the why. As a patient, you don't always have to know the why. Sometimes it's good just to know the how. I want you to know that what you do matters. Your movement in life, whether it is walking, dancing, running, doing yoga, meditating, this does matter. It's been proven by multiple studies. I'm always interested in the interconnection between nutrition, stress, inflammation, and metabolic health. If you've watched some of my other videos, you may have noticed me talk about these things. Hopefully this video will give you a little bit of insight into the endocannabinoid system, a very powerful system in your body that functions to calm you and also to decrease inflammation. Both of these things are very important for your overall health. If you are active, if you exercise, if you practice stress reduction techniques and follow a healthy diet, you are leveraging your health right there. So for me, I've never tried cannabis and I don't have an interest in getting high. I am interested in better quality of life. This is Jason Williams, DO. This is the Williams Family Medicine channel, and I want to help you live your best life. Signing off from Colorado.